Hello, everyone. I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the December 3rd, 2020 update from the Dubuque County Public Health Incident Management Team. Dubuque County's COVID-19 case total has reached over 9,400 cases, with 279 cases reported in the last 7 days. As I said on Monday, November 30th, even though our 14-day average positivity rate has declined to 15%, testing numbers are just starting to return to pre-Thanksgiving Day volumes. That, together with potential exposures through holiday gatherings, may result in the number of new COVID-19 cases rising again. The surge in cases over the previous few weeks is causing hospitalizations to once again increase, and Dubuque County has experienced a total of 94 deaths. That's an additional 3 reported this week. Yesterday, the U.S. had a record number of cases reported for one day, just over 200,000, along with over 2,800 deaths nationwide. And the U.S. hospitalizations also reached a new high, clearing 100,000. In Iowa, that number is 1,124 hospitalized COVID-19 patients. You get the picture? This pandemic is not slowing down. Even though vaccines are on their way, with Iowa expected to receive their first allotments of 26,000 doses of the Pfizer vaccine around December 13th, all of these first doses will be administered to some of the 154,000 healthcare workers in Iowa, along with long-term care residents and staff. Starting with the hospitals, it's going to take about a month to vaccinate the first priority groups. And this timeline will continue to change as the vaccine rolls out and additional vaccine manufacturers are approved for Emergency Use Authorization, or EAU, as it's referred to, through the FDA. To help everyone continue to practice mitigation strategies over the next several months, the CDC and the Iowa Department of Public Health have modified the quarantine period for exposure to COVID-19. We now have options to shorten the length of the typical 14-day quarantine timeframe in some situations. So here are the options for shortening the quarantine times. Quarantine can now be 10 days if you have no symptoms during the 10-day period, or quarantine for 7 days if you get tested no earlier than day 5 from the last exposure and the result of that test is negative. And, of course, you continue not to experience symptoms during that 7-day period. So you can either just do 10 days and not get a test, or if you get a test at a minimum of 5 days after your last exposure and the test is negative, you only have to quarantine for 7 days. With either option, after stopping quarantine, you should still continue to watch for symptoms until the 14 days after the exposure. And of course, if you do have symptoms, immediately self-isolate and contact your healthcare provider. And continue to wear a mask and stay 6 feet from others at a minimum. Wash your hands and avoid crowds, and take steps to prevent the spread of COVID-19. Remember, these are only quarantine guidelines for if you've had an exposure to someone with COVID-19 but not yet tested positive or developed symptoms. The best way to protect yourself and others is still to stay home for 14 days if you think you've been exposed to someone with COVID-19. These new quarantine guidelines are based on an extensive study and modeling by the CDC and others that show significant risk reduction after the 7-day and 10-day periods. This new guidance will also be easier to adhere to with the shortened timeframes, so people may actually follow these quarantine guidelines since they are significantly less time off work or school or whatever other activities people have to attend to. So the CDC has also modified some travel guidance. As I continue to hear predictions and know that we're likely to have well over 18,000 cumulative cases in Dubuque County by mid-January, the safest thing is to postpone holiday travel and stay at home. The CDC also stresses that, but if you do travel, the CDC recommends getting tested 1 to 3 days before you travel and repeating that testing 3 to 5 days after you travel. Of course, if you test positive before traveling, you won't be going anywhere. So all of this does require significant planning for travelers. So don't wait until the last minute to start thinking about testing, canceling, or other contingency plans you may need to make. And finally, as we head into the weekend and also continue with the holiday season, I know many activities, parties, and concerts are being canceled. Please take extra precaution when considering getting together with friends, especially indoors at private homes or other settings. The only thing the virus knows is who has not been infected, and that's where the virus will go, no matter where you are. It will continue to seek out people who are not yet infected. So when indoors with others outside your household, maintain social distancing, wear a mask, limit the time you spent there, shorter than you normally would spend at a friend's home. These may seem awkward when you're at people's homes or people you know, but if you can make the difference between getting sick and staying COVID-free, why not take those extra precautions? And no one wants to be sick for the December holidays. So have a great weekend. I'm still recommending getting some fresh air outdoors for a hike, a walk, or a front yard visit with your friends or neighbors. And stay healthy and safe for you, and because we're all in this together.